Hello, I'm Kathy Chandler with the Memphis Family Nurse Practitioner Program. I'll be doing my head to toe assessment. And your name is?
Derek Chandler,
What's your birthday?
June 27, 1971,
Do you know what today is?
March 26, 2023.
And you consent to this exam?
Yes.
Okay. I'm going to scan the room. So here is the room. This is our supplies. The floor. And the ceiling. Okay. Okay. Start by washing my hands. So I'll be assessing the skin throughout the exam on the face, head, neck, posterior chest, anterior chest, and abdomen for color, texture, temperature, turgor, edema, scarring, bruising, nevi, moisture throughout the whole exam. So I'm gonna check your head. The hair, we're looking for hair distribution, color, texture, any lesions, depressions, any infestations. Hair is good. I'm going to check your temporal arteries. Any tenderness?
No.
Okay. And then clench your teeth. Puff out your cheeks. Smile. Frown. Lift your eyebrows. Cranial nerve 5 is intact. Close your eyes. Tell me where I'm touching you.
Right cheek, forehead, left cheek, nose.
Okay. I'm going to check the lymph nodes of the head and neck. Tell me if you have any tenderness. Pre-auricular, post-auricular, occipital, submandibular, submental, anterior cervical, posterior cervical, I'm going to shrug just a little bit, subclavicular. Relax. Okay, we're going to look in your ears. First, I'm going to palpate your ears. Palpate the pinnae and the tragus, any tenderness. Ears are symmetrical. Look inside. Tympanic membrane is pearly gray. Cone of light is 5 on the right. For adults, you bring the ear up and out. Tympanic membrane is pearly gray. Cone of light is 7 on the left. I'm going to do a couple of hearing tests. I want you to plug this ear. I'm going to whisper some. Don't you tell me what you hear.
1, 2, 3.
Okay, plug this side.
ABC.
Okay. Now I'm going to, when I strike this, I'm going to put it on the top of your head and you tell me if you hear the vibration in both ears. This is called the, the Weber test.
Yes.
Okay. Now when I do it again, we're going to put it on the bone behind the ear, and this is called the Rene.
Yes.
Should... back, that's cranial nerve 8, the vestibular cochlear. We'll look at the eyes. We're going to be inspecting the eyes. We're looking at the lashes, the eyebrows, the papillar fissures. We're looking for the conjunctiva and the sclera for any discharge, any color changes. Everything looks good. I'm going to check for accommodation. So I'm looking to see if your pupils constrict. Just look straight out. Looks good. Okay, now I want you to follow the pen light with just your eyes, okay? We're checking cranial nerves 3, 4, and 6, which are ocular motor, ocular motor, abductions, and okay. So pupils are equal reactant to light and accommodation. Now I'm going to look at your eyes with the ophthalmoscope. So I want you to look straight up. Kind of light is the red reflex. Good. That's so cool to see in eyes. One more time, are you okay?
Mhm.
Red reflex is reactive. So cool to see that. We're going to check your visual acuity. Cover one eye for me. This is the Snellen chart. I want you to read the lowest line that you can read without difficulty.
LTFPH.
Okay, and close the other eye.
LTFPH.
Okay, do both eyes.
LTFPH.
Okay, so his vision is 20/20 with the Snellen chart. I'm going to check your mouth. I want to look at your teeth, your gums, inside of your salivary glands, your throat, tonsils, everything. Open your mouth. Teeth. Open. Move your tongue, stick your tongue out. Move it around side to side. Lift your tongue up. Okay. Again, put your tongue out. I want you to say ah. Okay, tonsils are surgically removed. Everything else looks good. Cranial nerves 9 and 10, which are glossopharyngeal and vagus, are intact. I'll check your nose. It's midline and straight. Any problems with your nose?
Mm.
No septal deviation. I want you to close one side of your nose. Sniff. Close the other side. Sniff. Now tell me what you smell.
Coffee.
Okay. So cranial nerve 1 olfactory is intact. Check your trachea. It's midline. Come behind you and check your thyroid gland. I want you to swallow for me. Swallow again. Good. Trachea. No mass is felt on the thyroid gland. Okay, turn and face this way. We'll check your posterior lungs. So I want you to, every time, I want you to say 99 for me.
99,
Again,
99,
again,
99,
again.
99,
Good. So check-in, his, has no trouble breathing, no tachypnea, no cyanosis, no tactile fremitus, no barrel chesting, everything looks good. So I'm gonna listen to his chest. So I want you to take a deep breath for me every time I move the stethoscope. Sounds good. Okay, now we're gonna check echophony. So every time I move the stethoscope, I want you to say E.
E, 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 E.
Okay, now we're gonna do bronchophony. So you're gonna say 99 every time I move the stethoscope.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, this is the whisper pectoriloquy. I want you to whisper 99 every time we move the stethoscope.
99, 99, 99.
Sounds good. Breath sounds are good. No timpani or any problems. Just gonna percuss. Everything sounds good. No resonance. Turn around for me. We're gonna do the anterior chest. Same thing. Just say 99.
99, 99, 99.
Good. I'm gonna listen. Just take a deep breath. Okay, we're gonna listen to your chest, to your heart. So just relax. I'm just gonna be listening to your heart sounds. The aorta, pulmonary, Erb's point, tricuspid, mitral valve, point of maximal impulse. You would listen for 1 full minute. Heart rate is 70 with no regular rate and rhythm. I'll switch it to the bell and listen again for any bruise, murmurs, aortic, pulmonic, herb, tricuspid, mitral valve. Carotid artery. Hold your breath. Breathe. Hold your breath. And breathe. Carotid pulses are 2+ with no bruit. Okay, we're gonna lay down on the bed. We'll check your neck for jugular vein distension if you'll turn that way for me. None noted. Turn this way for me. None noted. Okay, I'm gonna listen to your heart again. Aortic. Pulmonic. Herb's point. Tricuspid. Lateral. Femoral. The thrills noted. Aortic. Pulmonic. Herb's point. Tricuspid. Much better. Okay, I'm gonna lift your shirt. Do an abdomen assessment. His abdomen is round, non-distended. Any tenderness or problems?
No.
Okay. So I'm gonna note that there are no pulsating. Everything looks good. I'm gonna listen for any bruise over the aorta, the renal arteries, iliac arteries, femoral arteries, and I'm going to listen to the bowel sounds, starting with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Percussing, no tympany, no sound. I'm gonna lightly palpate. Any pain or any tenderness?
No.
Then you do deeper palpation, starting in the right lower, right upper, left upper, left lower. I should take a deep breath. Checking for the spleen, no tenderness. Checking for the liver, no tenderness. Rinse it up. Go back to the chair if you're more comfortable. So we're gonna check cranial nerve 11 is your accessory muscle. Shrug your shoulders and then push against me. It says cranial nerve 11 accessory muscles intact. Cranial nerve 12 was the hypoglossal, was when you stuck out your tongue. I think that was good. It was intact. Stick out your tongue again. That was cranial nerve 12. I didn't say that earlier. I'm gonna check your joints for any crepitus, any redness, tenderness, any problems with any of your joints. Check your hips, knees, check your radial pulses. Talus pubis, your tibial. All pulses are 2+. Strong. On my hands tight. Hand grip is 5 out of 5. Push against my arms. Pull against my arms. Arm grips are good. Push against. Push up. Push down. Good. Do the same with my leg. With your legs. Same with here. Push out. And then in. Leg strength is good in the thighs, knees, and in the feet and ankles. Arms out. And we need to do close your eyes and tell me if you feel something dull or sharp.
Sharp. Sharp. Dull. Sharp. Sharp.
Okay, so that's good. Your sensation is good. You need to check your cerebellum. So I want you to do finger to thumb. Do it back and forth, back and forth. And then I want you to put your hands on your legs and back and forth. Do it faster. Okay, now I want you to come to my fingers. Do one at a time? Is that easier?
A bit.
Okay, good. Now we're going to do the range of motion. So in your hand, you'll do your fingers first. Hold your hands out. Then we're going to do thumb opposition, which means your thumb goes out and thumb back in. And then we're going to do abduction, adduction, flexion, hyperextension. And then we're going to do the wrist, flexion, hyperextension, rotation. And then your elbows, flexion, hyperextension. Oh, I think you just moved them. Your shoulders, extension, hyperextension, adduction, abduction. Okay, now stand up for me. And do your lower extremity. Start with your hips. So adduction, abduction, adduction, abduction, flexion, hyperflexion, rotation. And circular for your hip. Okay, and then do your knee. Can you go back? And then that. Okay, good. Okay, turn this way so I can assess your spine. I want you to bend over. No pain or tenderness?
No.
Okay, now flex backwards for flexion. Stand up. Now I want you to bring your neck down, neck back, side to side, and then circular all the way around. Okay, turn around. Walk straight toward the camera. Turn around and walk toward me, heel to toe. His gait is good. Very good. And that concludes our assessment.